Imagine this every second, blood flows through thousands of blood vessels, carrying oxygen and nutrients into every organ. But what happens if one of those blood vessels suddenly get blocked? A heart attack or stroke can happen within minutes. So, how can one tiny aspirin tablet help prevent this? Let's find that out. Before we understand aspirin, let's meet the heroes of the story, platelets. So, platelets are tiny blood cells whose main job is to stop bleeding. Whenever you get a cut, platelets quickly gather at the site of injury. They stick together and form a clot that eventually stops bleeding. Without platelets, even a small cut could lead to excessive bleeding. So, normally, platelets protect us. But sometimes platelets become a problem. You see, inside our arteries, cholesterol plaques can build over many years. If one of these plaques suddenly ruptures, platelets think the artery is injured. They rush to the site and start sticking together. Instead of helping, they form a clot inside the artery. If this clot blocks blood flow to the heart, it causes a heart attack. If it blocks blood flow to the brain, it causes a stroke. Now, this is where aspirin becomes important. After swallowing aspirin, it is absorbed into the bloodstream and reaches the platelet. Inside every platelet is an enzyme called cyclooxygenase 1 or COX-1. Now think of COX-1 as a small factory. Its job is to produce a small chemical called thromboxane A2, TXA2. This thromboxane A2 tells platelets to form blood clots by making them stick together. Now, aspirin permanently blocks the COX-1 enzyme. So, once this enzyme is blocked, the factory stops working and hence no TXA2 is produced. Without TXA2, platelets lose their signal to stick together. They continue flowing normally through the bloodstream. As a result, harmful blood clots are less likely to form. This is why aspirin helps to prevent heart attacks and stroke in certain patients. Because of this unique action, low dose aspirin is usually prescribed to reduce the risk of heart attack and stroke. It is also used in patients with coronary artery disease and after certain heart procedures, such as stent placement. However, aspirin is not suitable for everyone. It should only be taken when recommended by a healthcare professional because it can increase the risk of bleeding. So, to summarize, aspirin works irreversibly by blocking the COX-1 enzyme in the platelets. This reduces the production of thromboxane A2, which prevents platelet aggregation and lowers the risk of harmful blood clots. Understanding this mechanism makes it much easier to remember why aspirin is one of the most important medicines in cardiovascular care. If you found this explanation helpful, don't forget to like, subscribe, and share. And let me know which drug would you like for me to explain next.